Hi, everyone. Hello, and thank you, Julie Jackson, for inviting me to give this relatively quick talk on the need for global definition of patient blood management. You could see from the first slide that this was published in the Journal of Anesthesia and Analgesia, and we're talking about last year. As I move along, let me try and see if I can move the slides. Let me express the need for global definition. First of all, patient blood management is an evolving concept. Why a patient blood management global definition is needed is something that we'll answer as we go along with the slide. And how was a global definition constructed? I think we need to know the inner parts of this particular moving definition, and what are the elements that are required, again, to put this definition together, and what are some of the key concepts that we want to get across in this definition. And then we'll present the final global definitions. They're going to be two parts. One part is for the public, and the other part, of course, is for the clinicians. And then I'll finish up with some next steps. Once we have this definition, where do we think we're moving? So I already mentioned that patient blood management is an evolving concept. Patient blood management is constantly being adopted across the globe. So again, we're seeing different cultures embracing patient blood management. Although it's adopted, implementation remains a challenge in many situations, and not necessarily those with low economic structure, but even across nations where there is wealth. Most, if not all, agree on the general principles of patient blood management, but again, I think that sort of looks at the center of PBM and not all of the other moving parts that need to be included. And what remains is the lack of agreed upon single definition that covers all domains and is globally accepted by all those who are moving into patient blood management. Now, it is an evolving concept. I'm just showing you this early publication in 2003, where we started taking care of patients for whom blood was not an option. Many of you think of those as being Jehovah's Witnesses, but you'd be surprised that there are many other patients who may fit into this particular concept where blood is not an option. And what we've developed is a methodology to treat these patients. And what is shown here in this table is the different things that we could do where, again, we're not using blood, but in fact, what we're using other methodologies which will save the patient's own blood, and we can return this to the patient under many circumstances. So we then went from bloodless, which is what we just talked about now, bloodless surgery and medicine, to patient blood management. And this started off with looking mostly at the surgical patients, and you probably are familiar, some of you, of the three pillars which were introduced, which again zero and concentrate on the surgical patients. The first pillar is optimizing hematopoiesis or hemoglobin prior to surgery. The second pillar, a very important one, is to minimize blood loss. It's not only surgical blood loss. And the third, of course, is to optimize the physiology of the patient so they can tolerate any new anemia that they have to face while we're treating and raising their hemoglobin. This is fairly, again, concentrated on, as I already mentioned, the surgical patient. What we've done, though, is moved over the years to include another area. So this is a four quadrants, if you will, rather than three pillars, where we talk about the same thing: managing of anemia, intradisciplinary blood conservation modalities, optimizing coagulation, and patient-centered decision-making. We're now moving in bringing the patient as a partner for their healthcare. None of these work unless we can demonstrate improved patient outcome, and we're talking about clinical outcome. Now, behind each one of these clover leaves, if you will, there's a list of things that we could do just like we had when we looked at the three pillars. So why a global definition? Well, it could help in consistent approach to implementation. As I already mentioned to you, that is a challenge. The diversity of different clinical settings, this may represent a common goal. So no matter where you are, whether you're pediatric, whether you are surgical patient, oncology patient, all of these have to converge to a common goal. The need for a statement which expresses the essential nature of something is essentially a definition. And we sometimes have the definition using the same word, which may not be helpful. So here we try to extract what we think is essential in defining the global definition of patient blood management. And there also needs to be a common understanding of patient blood management, which I will address with you in the coming slides. And a well-expressed definition of patient blood management can help shape practice, education, and research. So one of the issues is the patient blood management is not a blood transfusion, although some may define it that way. It is about the patient outcome. And we put this editorial out in 2019, and we did state that a patient-centered approach that seems to constantly drift towards transfusion. So people start with the concept of patient blood management. By the end of the day, they end up talking about transfusion and trying to look at what's the best transfusion practice, which brings us to an important slide. This slide, and I have to credit Cherry Ozawa et al. For putting this one together, shows the differences between patient blood management and what we call OBU, or optimal blood use. And the important part is that patient blood management promotes therapies for anemia, bleeding, and coagulation, whereas on the other hand, OBU promotes evidence-based transfusion practices. Both have lots of meaning and importance, but they're very different. And number 4, you could see that patient blood management seeks to protect and build a person's own blood, whereas OBU seeks to improve blood component utilization. Hence, at the end of the day, PBM, or patient blood management, the goal is to improve blood health of the individual patient, whereas optimal blood use is minimal effective dose of blood components. And hope that gives you a good background in terms of the differences between the two. So why a global definition? Once defined, it can provide a framework for practice as well as collaboration and growth of the concept throughout the globe. Those involved in patient blood management are from a diverse background, but have a common interest in patient blood management, again, in blood health and individual patient. Based on their bias, they will see patient blood management as one aspect to define patient blood management. I will say that AABB in the United States sees patient blood management as a vehicle for transfusion, where already mentioned, it is not. Getting everyone on the same page will provide a clear statement that can be used to define patient blood management as a practice. We can also develop benchmarking, performance enhancement, and of course, better patient experience, including clinical outcomes. So how was this global definition constructed? What we did is convene as many experts in patient blood management, and it was not restricted to physicians. So again, keep in mind, any one of you could have been participating in this. Gather as many representatives from all corners of the globe. The efforts this effort was led by Society for the Advancement of Patient Blood Management, NATA, the International Foundation for Patient Blood Management, who constructed the initial draft that was then reviewed by all of these involved. Now, the elements that were needed for the definition of patient blood management, or I should say the global definition, and we needed to, again, start with a background and understanding of the evolution of patient blood management. We needed the long view, the history of patient blood management as it evolved from bloodless medicine and surgery to what we call today patient blood management. The early success of treating patients with blood transfusion were not an option, I think gave us the initial framework. The pressure to reduce exposure to allogeneic transfusion due at the time to HIV and hepatitis C epidemics, again, was another force, if you will, for us to look for the long view of the evolution of patient blood management. And of course, emerging data on poor outcome of transfusion, not based on just infectious causes, but other, including immune modulation. So the clear understanding of the difference between transfusion medicine, optimal blood use, and blood management, as well as patient blood management, were essential for the individual participating in creating this definition. I already went through this, and I hope, again, that you see the differences. So optimizing transfusion or appropriate transfusion is not central to patient blood management. That is not to say that it's not important. It is extremely important, but patient blood management zeroes mostly on the individual patient outcome through, again, the patient's blood health. The evolving number of publications over the decades supporting the concept of patient blood management is actually growing. And we see a lot of this as depicted in this particular chart, that since the early 1980s, there has been now a significant increase in patient blood management, bloodless medicine and surgery, blood conservation strategies, and bloodless surgery in terms of peer-reviewed publication. The importance here for why I'm showing you this is, even though there is a significant increase in these publications, many of them did not define patient blood management according to their own bias, rather than to a single global definition of patient blood management. And you will see that there have been many definitions. Again, having an understanding of the past and present of patient blood management, we have to move from the product to the patient-centered approach, the difference between transfusion medicine and patient blood management. There needs to be a demonstration of better clinical outcome in terms of what we do. Again, weaving patient safety into the concept is essential. In the dynamic evolution of patient blood management definition, their strength and weaknesses are very important for us to define. And hence, you'll see in the next slide that there have been many. We're not including all of them in this particular slide, but you could see on the right side the date that they were published, and then the different organizations having different definitions of patient blood management. If this is not enough to, again, entice you to get a single global definition, I don't know what is. And some of these, as I already mentioned, are biased and see this through transfusion. And others see this through the patient's outcome, clinical outcome. And then, of course, some look at this specifically through the blood health of the patient's own blood, meaning individualizing the care. So this brings us to the key concepts of global definition. First of all, it has to be a patient-centered approach. The patient's values, preferences, and choices, the patient empowerment portion of it, must be included today. We need to partner with our patients because their expectations and our expectations may not be the same. And we need to reach a point where the goals that we have for that individual's health are clear, not only clear, but also we meet the expectations as well as the patient can express their expectations. And then again, we have to align our goals together. The power or the right of the patients to intervene is very essential today. May not be across the board, but I think we still make sure that this is part of the definition. And here's a quote. This is from Osler: "The good physician treats the disease. The great physician treats the patient who has the disease." So we're moving again from what we were at a status quo of dealing with products, transfusion products, to now centering again on the patient and what needs to be done appropriately for that patient. A comprehensive approach to anemia and homeostasis is essential. The diagnosis and management of the above, identifying the source and other deficiencies of the patient. We have been used to having a monotherapy for all of these, but now what we need to do is to step back and look at the etiology of why there's anemia, why there's a coagulation defect, and then use the appropriate interventions, trying to, again, reduce the patient's exposure to allogeneic transfusion. There's a need for a comprehensive approach to blood loss, all the way from phlebotomy to surgical blood recovery. We always think about surgical bleeding as being the most even trauma, but all hospitalized patients in the Western world are phlebotomized repeatedly as long as they're in the hospital for no good reason most of the time, except for one. We know that what happens after the repeated phlebotomy is the patients get anemic, and if they reach a threshold, they will be transfused for the phlebotomy. So this is an iatrogenic issue that needs to be addressed. And last is an evidence-based approach, supportive data, and known best practices that is multidisciplinary and preventative rather than reactive. So I think it's very important for us to start off on the right foot when we're looking for the definition. So here's the final global definition, which was intended for the clinician. And let me read it to you. It says, patient blood management is a patient-centered, systematic, evidence-based approach to improve patient outcomes by managing and preserving the patient's own blood while promoting patient safety and empowerment. The same goes in different language for the layperson or the public. That patient blood management is a patient-centered and organized approach in which the entire healthcare team coordinates efforts to improve results by managing and preserving the patient's own blood. And what else? What happened after that? Well, we published this also in 2022. This is patient blood management, improving outcomes for millions while saving billions. What's holding it up? And I think it's important for us to understand that when we look at this particular publication, there is a concept of what we call the 3 E's. And I'll show you or illustrate the fact that we have the evidence on the bottom of left side of this slide. I've showed you many publications. We have a lot of data on patient blood management, both in terms of need as well as in terms of answering that need. We also have the economics, and I'll show you some of the data on that also. We know that by implementing patient blood management, we could save enormous amount of resources as well as money for healthcare. So the last of the E is the ethics, meaning if you have the evidence and you have the economics, you also have the ethical obligation to act and to implement patient blood management. And in October of 2021, the policy brief from the WHO came out. It's called The Urgent Need to Implement Patient Blood Management. And here what we demonstrated based upon a very large publication from Western Australia, a demonstration project of patient blood management where hospitals were converted to deliver patient blood management. At the end of this particular exercise, you could see that there was improvement in patient outcome, the central theme of patient blood management. A reduction in mortality, reduction in infection, reduction of cardiovascular disease, as well as length of stay. There was also key program indicators which also improved. One is looking at preoperative anemia, although a reduction from 21 to 14% still leaves an opportunity. There is movement there. Pre-transfusion hemoglobin from 8 grams per liter, 80 grams per liter, down to below 75 grams per liter. And the single unit transfusion increased significantly. So although there's some opportunities here in the key program indicators, the movement was in the right direction. And then there was a reduction in units of blood transfused, 41% reduction in red blood cells, 47% in plasma, and 27% decrease in platelets. All this, as you could see at the bottom of the slide, led for a significant dollars, that's Australian dollars, as well as resource reduction in utilization. All this can be either put in the pocket, if you will, of healthcare, or could be better repurposed for improving, again, the services that we have. And I know that most of us, both US and UK, are struggling right now with the cost of healthcare and the fact that we are limited in resources, even in countries where our economy is actually strong as compared to some other countries in the world. So in summary, we talked about patient blood management as an evolving concept and the need, the fact that there's so many definitions out there. And this is why we need a global definition, not only to direct the clinicians in terms of a purpose and a single goal, but also to unify the different definitions out there. We went through how it was constructed. We talked about the elements needed for a global definition, some of the key concepts that are in a global definition, including empowerment of patient. And then I read you the final definitions, and we just went through the next step. So with this, I would want to thank you for giving me the opportunity to give you this short talk. And again, I want to thank Julie for inviting me. Have a wonderful conference.